So, is functional medicine right for you? In this video, I'm going to talk about the pros, the cons, the benefits and challenges of functional medicine, and we're going to get started right now. Well, hello everyone, I'm Dr. Glenn Harrison and welcome to this week's segment of Why. This is where we take just a few minutes to answer some of the most common health-related questions that I see in my clinic every day. And this is a question mostly when people are seeking out answers, some health answers, and they hear about functional medicine. So this is, if you're watching this, you're probably wondering what is a little bit more about functional medicine and if it's right for you. So I'm gonna answer these questions. But the things that I see from a question standpoint is really, they don't know if it's right for them. So hopefully I can clear the air and then you can see if it's right for you. So functional medicine, the first thing to know about functional medicine, it is not for acute problems, not for acute conditions. It's designed for chronic illnesses. So disorders that have been going on for 3 months to 30 years. If someone has a cold or a fever or a new skin disorder that just came on, chances are functional medicine is not going to be right for you. Now, if you have frequent colds, you're always sick and you always have skin issues and so on and so forth, well, that would be more of a chronic disorder. That's where functional medicine would shine. So functional medicine is about chronic conditions, not acute disorders. So that's the first thing to know with functional medicine. Okay, other things about functional medicine, and I'll get into the pros and cons, but I've been practicing functional medicine now exclusively. That's all I've been doing for about a decade. So, and so it's not a watered down form of functional medicine, and that's the thing. What I'm going to explain today is functional medicine the way I practice. It's not watered down. It has all the bells and whistles. It's what I see as the best, okay? But you reach out to other clinics and stuff like that, they're going to do things maybe a little bit differently, but this is really the core, elaborate functional medicine, okay? Just so you know there's some variation. So the first thing to think about, and I'll talk about some of the benefits of functional medicine, and it's the number one thing why people pursue functional medicine is to find the root cause of their health disorder. So functional medicine tends to use really advanced diagnostic lab testing. And the reason why it has to be really advanced and very in-depth is because the core of functional medicine is to find the problem. Find the root of the problem, not just the problem. Conventional medicine looks for the problem. Functional medicine is a bridge. It's looking really, really deep to find the source of the problem. Because if you don't find the source of the problem, it's probably going to come back, or you're going to have to mask it with excessive pharmaceuticals and things like that. And there's places for those. But functional medicine, very advanced diagnostics, deeper than what you would find in conventional medicine, to find the source of the problem. That is the fundamental, the number one thing that differentiates functional medicine from other forms of clinical efforts in medicine. The second thing functional medicine should focus on, now this is the way I practice, is education. Education, I've learned over the years, it's not what people are coming to me for. They're not coming to my clinic, I want to learn about this disorder. No, they're coming to get better. But if people don't know why they're doing what they're doing once they start working with me, if I'm not teaching them why we're taking this step, what to look for, how they ended up in this situation to begin with, why their blood chemistry is abnormal, what their blood chemistry means, it's just doctor telling patient what to do, and they never, and then the moment there's a problem, they have to run back to the doctor, they have to come back to me. My clinic focuses, the goal is health independence, so there's no revolving door, and education is that bridge. It empowers people to understand their disorders. So health education is a critical component of true functional medicine. So that's the second thing. So education. The third thing, and education, like I said, is critical, is absolutely imperative if you want to learn how to take care of yourself. Right? So the third thing, number 3, is guidance. So with chronic illness, and this has been going on for years, or usually years, and months and months and months and months. Chronic illness, there's no silver bullet. I wish there was. There's no silver bullet to take out the chronic illness and be on your way and everything is better. It turns out to being a journey, a navigational strategy as you're navigating through obstacles to get an improvement and an improvement. And because it's a navigation, functional medicine should be helping you and guiding you. So number 4 is guidance. They should be guiding you through the process of why they're doing what they're doing and while they're doing it, what to expect, why we're doing what we're doing, and how to take that next step. So there should be constant guidance and navigation and pivoting. Functional medicine providers should be pivoting as soon as there's an obstacle. So versus conventional medicine, where it's kind of like, here's your medication, run with that. Maybe it's a month, maybe it's 30 days, maybe it's 2 weeks, whatever it is, and oh, there's a problem, then come back in and we change a medication. That, I guess, is a form of navigation, but it's not real time. Okay, so number 3 is guidance. Okay, then the number four part of functional medicine is collaboration. So depending on where you are in the world, I'm here in the United States. Canada and the United States are relatively the same when it comes to medicine. I'm originally from Canada. I got to see both sides of the medicine line, I like to call it. But collaboration is very, very hard in the Western world between medical providers. It's very, very hard. Functional medicine, on the other hand, should have enough time to spend and communicate with other medical providers on your team and start collaborating with them, knowing the whole story. This is something that I do every chance I get. It's very, very important. So that's another benefit of functional medicine. So you're not bouncing around different doctors, different stories. You don't know what's going on. Then the fifth thing, the fifth thing is health independence. Now, I've talked about this already, but functional medicine should be designed that there isn't a revolving door. You work on the case very, very in depth with your functional medicine provider, and you work on it, you navigate through it, you get on top of that mountain, you're feeling better, you know what you got to do on your own, and you should be able to take care of yourself. Should be fewer doctor's appointments, maybe check-ins farther apart. It shouldn't be this revolving, constant dependency. Okay, so there's another great benefit of functional medicine. I believe health independence is the only form of health. If we have to depend on doctors and doctors and doctors, that's not health. That's dependency. We need some of it, but it should be absolutely minimal. Okay. Now here's the challenges. Now there's two big ones, and these are challenges and obstacles that I see in my clinic. Okay. The biggest one here in North America or the United States, where I am, the biggest challenge is medical insurance. Medical insurance does not cover functional medicine. Now you're gonna reach out, if you reached out to other clinics and stuff, they'll say, oh yeah, we can cover some of it, or insurance could cover some of it. About that much, because insurance is designed for acute emergency care. It's the best for surgeries, best for infections. That is what it's for, heart attacks. Functional medicine takes so much more time, so much more clinical investigation that insurance is not designed for this. I always like to say insurance is designed like auto insurance. If you get an offender bender, hail damage, whatever it is, that is what it is. It's an emergency, it's a surprise. It's the same reason why auto insurance doesn't change the oil on your car. It doesn't pay for brake changes and changing your brake pads. It's not designed for maintenance. It's designed for emergencies. So we tend to not see insurance cover pretty well anything with true functional medicine. So that's one obstacle because it's cash, right? So there's an obstacle. The second challenge, which I think this is obvious, is time. It's going to take time. I work with people that have been dealing with issues for 30 years. It's going to take time, but it shouldn't take years. Not the way I practice. It should take months. It's not going to take years. It's not going to take weeks. It's usually really intense months where we're hitting it, we're focusing on, we're pivoting it, and getting you on top of the mountain, and you can take care of yourself. Okay. So time. We grow out of our health, and we grow back into our health, and it's going to take some time. That's the second challenge. I don't know, anything, and the third one, this takes me to the third challenge. It's going to take some work, and it's going to take some consistency. And I've done a video on consistency or maintaining behaviors, but it's going to take that. And the truth of the matter is there's nothing in your life or nothing in my life that was of any value that did not take work or effort. Health is no different, but you just need that guide, you need that direction, you need to understand the root of your problems. So anyway, that's a fair bit on functional medicine, but hopefully this gives you some information to know if it's right for you, because you'll read all sorts of fun stuff online and all these amazing things, and it can do that, but you should know what you're getting yourself into before pulling the trigger, before testing before diving down that rabbit hole. But if you have a chronic illness, I don't think there's any better way to pursue it and to correct it, providing you're willing to put in the work. So if you are dealing with these any kind of health challenges and looking for answers, there's a link right below this video. You can click and you can have you can schedule a free 15-minute conversation with myself, directly with myself, where we can talk about your case and see if we can help. So anyway, with that being said, I'm Dr. Glenn Harrison. I hope you enjoyed this video, and I look forward to talking to you next day. We're going to answer the why to another health-related question. Have a great day.